Hi, welcome to another episode of Unlocking Medicare. I'm your host, Tyrone Carr. Today we have another special guest, Lobert, friend and local business owner in the community. And we met a few years ago at a business meeting, networking meeting, and I was involved in a critical motorcycle accident over in Italy. And I think at the time I was on crutches, and you had approached me kind of like, what happened to you and all that stuff. And then the doctors had told me like, oh, I didn't need to do PT, after the surgery and all this stuff. And then fast forward, it was like 5-6 months later, and I reached out to you and I was like, Lauren, there's something wrong with my leg, and there was just noticed that there was a lot of, strength that wasn't there and stuff like that, range of motion. And so you guys did a great job, and still to this day, I still talk about how great you guys are and what you guys did for me and stuff like that. So again, thank you for being a part of the show today. Yeah. And so, outside of providing information when it comes to Medicare Advantage, drug plans, and supplemental insurance, we wanted to provide our community with a lot of added value as far as whether it be primary care doctors, chiropractors, physical therapists like yourself. And so is PT, whether it be pre or post-op, or whether it be a knee or hip, elbow, shoulder, like tell us a little bit about
Absolutely. So there's a lot of research about physical therapy being extremely beneficial for people with arthritis to manage their pain, maintain their range of motion, increase their strength. And a lot of people, they've been told they need a joint replacement, right? And so there's no point, like, I'm doomed, I've got arthritis. It is what it is. When I'm ready to get the joint replaced, I'll do it. But, physical therapy can be really helpful even if you do decide to have the joint replacement. Because it can help, like if you haven't been able to fully straighten your knee sometimes we see people 5-10 years, they haven't been able to straighten their knee, and they think just because they get a joint replacement, boom, they'll be like good to go. But there's a lot of soft tissue issues that occur, and everything gets tightened up, and that recovery is significantly harder. So there's always a chance that you might be able to push off the joint replacement or just manage with, some people need injections, some people physical therapy is enough, and strengthening and getting on an exercise program where they decide, their pain's under control, they don't need the joint replacement. But even if you do decide to, you're going to be better off after the surgery. The recovery is going to be easier, you're going to get around easier, you're going to be able to move better. The rehab will be easier because there will be rehab regardless of, it's like you want to do it before, you want to do it after, but like you're going to have it after the joint replacement. So physical therapy is great for patients with arthritis, whether or not they decide to have the joint replacement. And the research shows it's a great way to manage the pain conservatively.
So is there, like from your practice, your office specifically, is there an area of expertise that you guys have focus? I mean, I know as far as my motorcycle accident, it was my leg, my ankle, and all that.
Yeah.
But is there because you hear about different PTs, and at least I have, that have a certain certification or anything like that. And I know you're an athlete, you play hockey. Well, I probably don't know if you still do, but as far as from an athlete versus someone who is, retired, that's elderly, is there a different approach in how you handle an athlete versus someone who's younger?
Not necessarily. So we specialize in manual therapy. So the majority of our therapists have gone through a 2-year certification program, or 2-year residency program after their doctorate. And that's in advanced manual therapy techniques. So we do a lot of hands-on stuff as well as individualized exercise. And then because we see patients one-on-one for a full hour, which is different from almost every physical therapy place, and definitely every, national chain of physical therapy place, where they can see anywhere from 2 to, 5 patients an hour per one therapist. So you've got us 60 minutes one-on-one. And, our mindset is like, yes, we see a lot of athletes, but we see a lot of people who we would consider athletes, whether it's like, all right, I want to be able to golf, or I want to be able to garden, or I want to be able to pick up my grandkids. or crawl on the floor with them, or I want to be able to jog because if he goes to try to cross the street, I need to be able to stop him. Things like that. So like it might not be a traditional athlete where they're competing, but everybody has goals.
Sure.
And whatever that is what we're going to try to kind of tailor our treatment towards.
I think one of the things that I noticed, from, previous PT offices that I've used, you hear about like ATI and some of it is just to your point. I remember the physical therapist got me set up and like do this, and then all of a sudden they walked off and they're over here helping two or three other patients, and you're like, okay, I'm done.
Right.
Like, what do I
I'll
what do I
keep
do now?
going, I
I'll sit
guess.
here like, and you're like waving your hand. And I think that was one of the things that I really appreciated about Apex was that, your team of physicians were hands-on, one-on-one, just the attention to detail and just making certain that just because you're doing it, you have 10 reps of that particular exercise, you have it's like that seventh one, the eighth one, the ninth one, like you may not be doing it the way that
Yeah.
you should be. And so you have someone there to push you
Right.
versus someone who's like, okay, I'm just getting through this to get through it. And
Right. And honestly, with like healthcare costs rising for the consumer and people being busy, they got jobs, they got kids, they got, they have lives. Um, that traditional model of like, oh, I go 3 times a week for 12 weeks and I, do my exercises and I get a hot pack or an ultrasound and I go home, like that can cost more than $100. And what are you really getting out of it? So we have a lot of people who kind of like given up on the idea of PT. They're like, it's pointless. Like I learned my 3 exercises, I do them, or I looked up this stuff on the internet and I've been working on that. And it's a shame. It's a shame for our profession. And we're trying to, change people's minds and give them a better experience because that's what people deserve.
there's a lot of marketing material that people receive in the mail. There's commercials, and they're really pushing the Medicare Advantage. And I know, and I don't know how much you know, but I know there's some level of education that you have when it pertains to a traditional Medicare and a Medicare Advantage. There's a lot of co-pays with the Medicare Advantage. And so we often find that someone who either is transitioning to Medicare, or maybe they've been on Medicare, now they're transitioning to a Medicare Advantage, and nobody's fully explained the difference between just like, hey, now I'm going to go have this PT. Like I had one of my appointments this morning is that, the hip replacement. And it's like, well, one, if you've been told you're going to have a hip replacement or any type of joint replacement, you have to wait until that's actually completed to go from one Medigap to another. So your only alternative option is a Medicare Advantage. But with that, they need to understand that if you had a traditional Medicare and a Medigap, it would cover everything 100% minus your deductible. Whereas you go into this Advantage, now you're getting copay after copay for each and every single visit. Plus, there's limitations that we've experienced in the past. So can you speak to that as far as what, from the dealings with traditional Medicare versus Medicare Advantage, how that impacts on the business side of PT and what you guys have to deal with?
It's awful to have to tell somebody that like you don't have any visits left and they're not better. And you know that if they were able to continue to come, they could get better. So some of the plans, they might, look at your diagnosis, look at some very minimal measurements that we take. So they might look at your strength, which we grade like 0 to 5, or your range of motion and be like, oh, well, that's like pretty good. So we'll give you 8 visits. It doesn't matter if your physician believes you need more, if you want to keep coming, if your physical therapist, your doctor of physical therapy is telling them that they can still help and that it's medically necessary. Some of the plans are like, oh, well, you used your 8. So that can be a barrier. And we've had people who, yeah, they might have $20 copays, $40 copays, and you're asking somebody to pay $40 twice a week, $80 a week. That's more than $300 a month, and people are on fixed incomes and they just can't do that. So, they're trying to figure out how to best manage that when ideally they can come receive the care that they need and, finish their plan of care. So with a traditional Medicare plan, usually you get the 20%, it covers 80%, and either the patient has to pay the 20%, which would be usually around $20 a visit, or they have the secondary insurance that picks up the 20% and then they don't have anything. But yeah, that would be, $20, $25 a visit most likely, which is less than, $30, $40
Yeah.
copay, which a lot of the patients have. And then people also have this idea that, a lot of people ask, like, well, how many more visits do I have if they have a traditional Medicare plan? How much longer can I come? And they don't have strict guidelines for us. It's based on our discretion and us properly documenting that there's medical necessity. So there's different thresholds. So there's a threshold dollar amount. And once you've met that first threshold, you need to continue to document medical necessity. So there's things we can do to help not get flagged, right? I can't say Tyrone wants to keep golfing and that's the only reason why he's coming. Medicare doesn't particularly care if you can golf, but they might care if you can, walk up and down the stairs, bathe yourself, shower, dress, things like that. So just, things that we can document to ensure that that's not going to be an issue for us. But, we can go past that first threshold to the second threshold. No one says anything. If we believe that you need to continue to come and we document that, you won't have a problem with it. And same thing past that second threshold even. If we do that all the time with every single patient and just see them, 4 times a week, 52 weeks a year, like Medicare would see that we are overutilizing and probably do some chart reviews, but that's all on us, So with a traditional Medicare plan, we don't have to worry about, let's say you hurt your back and then, we went through your plan of care and then later in the year you decided to have a knee replacement. It doesn't matter what we used before. You still have that coverage because your doctor feels it's medically necessary, because we feel it's medically necessary, and because you want to come. So it gives us a lot more freedom to provide the care that you need.
I think that's the way it should be. I mean, if the doctor is saying that you need this, and I've certainly dealt with that with a lot of clients, specific carriers. We'll keep them nameless.
It's crazy. Yeah, it's crazy because patients will be like, well, what if I get another script from my doctor? And you're like, yeah.
That's great.
That should be the case, right? That your physician and your physical therapist determine that this is the care you need, but there's like somebody in an office somewhere being like, oh, well, you can have one more visit. Like, you don't even know this person.
You were hit by a train,
Yeah, they're like, well,
6 visits weren't enough.
Yeah.
Yeah.
They're like, but your range of motion's like pretty good. You're like, okay, well, this person was like running marathons before and now they still have a cane.
Yeah.
How is that sufficient? They're like, that's what you get.
Yeah.
So yeah, it can be really frustrating and it can be hard to explain to a patient. And then there ends up being cash pay options, but that's when you have like, what's the insurance for then?
Yeah. And that's the patient's frustrated and
rightfully so.
Fixed income, and you're like, well, but that's why I have this insurance, I thought. And so I know as an agency, that's one of the things that we try to explain, really the difference between traditional Medicare, Medigap, and then Medicare Advantage, because there are certainly better Medicare, and I know they've evolved, so they are evolving and they're getting better every single year, but sometimes, they become fixated on, oh, I get a free gym membership and I get, free over-the-counter benefit and free teeth cleans, but okay, it's not medical insurance. So like what happens when you are hit by a bus or, figuratively speaking, or, you have a stroke, a heart attack, how well is that plan going to cover you? And so,
or you have physical therapy for your shoulder and then you need shoulder surgery later. And they're like, well, you already saw PT for your shoulder.
Yeah.
We're done. We covered that.
Yep. And they don't understand, so it's just, they're just looking at a piece of paper and saying, oh, well, you did this. And so that's it, so, but.
And that's why we send them to you.
Yeah. So what is, if you were to give somebody, a last tip or whatever, for somebody who, whether it be somebody who's an athlete, 25 years of age, or somebody who's, our traditional client, someone who's 65 years of age or older, if you give somebody a piece of advice, whether it be, pre or post-op, when it comes to PT, what would you say to them?
I would say, do what your physical therapist tells you to do.
I agree. I second that. So, well, I appreciate you coming on the
Yeah,
show,
thanks for having
and
me.
it's great to see you, and that you're doing so well.
Thanks.
And you actually really quick, you
Yep,
guys opened up a second location. I
we
know,
did.
yeah.
Yeah. Yep.
And so that's Farmington Hills.
Farmington Hills. Yeah, we're right on the border of Farmington Hills and Novi. We're at like 10 Mile and Grand River, right off that Grand River exit off of M5.
Okay. And I've just, is that part of, there's the ice rink out there,
Yeah.
or is it?
So we're in a building called the Athlete Lab,
Okay.
which is owned by the people who own the ice rink across the street, Suburban Ice Farmington Hills.
Okay.
It was a complex primarily built for to be a science and evidence-based space for their elite hockey players to train, get rehab, study. They have something called the Mind Gym and all of this virtual reality training and things like that. But we're the physical therapists in there, and we operate our normal business. So we see same thing as in Brighton, the whole lifespan. We've got, patients 6 up to 96. And yeah, so you don't have to be an athlete to go to physical therapy there, but we do see
Okay.
a lot of those athletes as well.
Cool. Well, I'm glad to remember that, so we give you props. That
Yeah,
way,
thanks.
people, if they're out
Come
in
see.
that area, say, come see us. So, and again, thank you for watching another episode of Unlocking Medicare with Tyrone Carr. And again, it's more than just, helping people understand Medicare and supplemental insurance and Medicare Advantage, but just helping our community with other areas of service. And so I worked with Lauren, and she worked with me as far as helping me get back to where I am today. And I can't thank them enough as far as what you guys did. And I just think so much of you guys. And so if you're looking for a physical therapist, a location in Brighton off of Grand River, and as she just mentioned, in Farmington Hills. So give them a call, Apex Physical Therapy. And again, thank you, and stay tuned for another video.